A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
Going to the dentist. It's something we all have to do. But does the thought of going to the dentist make you anxious? Has a bad experience years ago held you back from making that appointment? Or are you in need of some expansive dental work, but are concerned about the time it takes or the cost? On this edition of Your Hometown Health Connection, we'll find out why you and your family should consider a visit to Pure Dental for that forever smile. I'm Kim Piazza. Welcome to the program. Joining us for this dental edition are Dr. Gregory White. He is a board-certified oral maxillofacial surgeon specializing in implantology and sedation dentistry. He graduated first in his class at the University at Buffalo of Dental Medicine and continued with 4 years of surgical residency at the University of Cincinnati. Dr. White has continued to train with experts around the country to learn advanced implant techniques in order to provide the highest levels of care. He is licensed in general anesthesia and takes pride in providing a comfortable patient experience. Dr. White's goal is to provide every patient with the same care and respect he would for his own family. He's dedicated to being a lifelong learner, as well as being an educator, and stays current with new technologies and procedures to provide the best care for his patients. He is an active member of numerous dental and surgery societies, as well as professional study groups. In his spare time, Dr. White likes doing projects around the house and yard, being outside, and spending time with his wife and 2 children. Also joining us is Dr. Elizabeth Michaels, a native of Hamburg, New York. Dr. Michaels graduated summa cum laude from the University at Buffalo with a bachelor's degree in chemistry, completing her doctorate of dental surgery at SUNY Stony Brook in Long Island, where she was the American Student Dental Association philanthropist, participating in many outreach trips, including a mission to South Dakota to treat the underserved. After dental school, Dr. Michaels completed a general practice residency at NYU Winthrop Hospital, where she had training in all aspects of dentistry and experience treating medically compromised patients. Dr. Michaels has a focus on cosmetic and implant dentistry, passionate about making her patients feel confident in their smiles. Dr. Michaels is a member of the American Dental Association and 8th District Dental Society. When not practicing dentistry, Dr. Michaels can be found at the gym, roller skating on Buffalo's many bike paths, or spending time with her family, friends, and crafting. Dr. Michaels, Dr. White, thank you so much for joining us. So I want to start off by asking you, who comes to your office? Who are your patients?
We see patients from all over, all different ages, a wide age range of patients we see coming from different backgrounds, different dental backgrounds.
And you offer lots of services, but before we discuss your services, I want to get into the dentist makes me nervous. So I'm sure you have a lot of people who walk through your front door and they're just a nervous Nelly, and you have to deal with that. What do you do?
You're not alone. So 90% of our patients have quite a bit of anxiety coming to the office. We try to make it a nice spa-like environment, very, low-key.
Warm and inviting.
Warm and inviting, absolutely.
And how often should I see the dentist?
We recommend every 6 months. Is generally how often for your checkups, for your cleanings, every 6 months.
So if you've got folks coming back every 6 months, that tells me you successfully make them feel comfortable when they are in the office, in the chair, having work done. What are some of the risks if people neglect to go every 6 months?
There's several things. I mean, for our purposes for implant dentistry, we want to make sure that everything is still looking good. As far as general dentistry, we want to make sure that there's no cavities that become something more involved. And then we want you to see the hygienist regularly for cleanings to remove any kind of tartar that you can't remove at home.
So that every 6 months is basically running interference.
Yes, that's a good way to put it.
And then you won't end up with massive work and a big bill because you've taken care of yourself.
Yes.
I know that technology is just cutting edge in your industry, and the way that you can handle someone's needs, something about 3D and looking in the mouth. You got to explain this to me.
So we have a very neat 3D x-ray that shows us a lot of information. It shows us kind of everything we're looking for. And then we also have a lot of 3D digital technology that helps us achieve very aesthetic results for our patients.
And when you're looking in your patient's mouth, what are you looking for?
So when patients maybe haven't been to the dentist for a long time, we're looking for any kind of cavities, infections, really anything that's falling into disrepair.
So there are lots of ways your smile can be the best that it can be, and you can make an appointment by calling Pure Dental at 716-528-6387. When we come back after this break, we'll find out everything you need to know about dental implants.
I just always loved music. I played instruments all through elementary and junior high. I had a broken jaw. I was 19 years old, which really started the spiral down with my teeth. And I never had a positive experience ever at a dentist until Pure Dental. It's very emotional for me too as well. You know, they just changed my life. I am so proud to smile and laugh, and I didn't do that for 20 years. I couldn't have asked for anything better. Great people, great procedure, great outcome, obviously.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
I'm Kim Piazza. Welcome back to your Hometown Health Connection. We're joined by Dr. Gregory White and Dr. Elizabeth Michaels from Pure Dental. Doctors, let's talk about implants. And there's a lot to talk about. So when we talk about implants, I know there's a difference between conventional and mini. Maybe we could start there and tell us what you prefer.
Yeah, so really with an implant, it's really just a titanium screw, and these have been around since the 1960s.
Really?
But it's like a synthetic root, so we use it in a lot of different ways. They're an anchor point that we can build lots of things off of it. When we talk about implants, most of the time we're talking about full-size implants, which a lot of the data supports. With mini implants, they do have a lower success rate. And so we typically only place the full-size implants.
So you prefer the conventional.
We do.
I had no idea that implants had been around since the 60s, which, I mean, so that's a very proven approach to your mouth, the implants. So you've got implants. What is involved in a full mouth reconstruction? So
in a lot of times if patients maybe they don't have teeth anymore, or they're indentures, or their teeth are falling into disrepair that they need all of their teeth out. One of the things that we'll do is we can build a whole entire new set of teeth with dental implants. So using 4 to 6 implants, typically sometimes more, we can build a whole entire fixed permanent implant bridge that does not come out, and it just functions like a natural set of teeth.
Tell me, how does that work with dentures?
Completely different from dentures. Dentures are something that people take in and out every single day, and it can be a lot mentally to take out your teeth every night. Mm-hmm. With this, it's permanent. It's in your mouth. It doesn't go anywhere.
The implants, permanent. Do you ever find situations where you have patients who want to have implants as well as dentures?
Sometimes we can combine those two. So a denture, those are just really sitting on the gums, and people use glue, but otherwise they do shift around and they can come out, they can get food underneath, and they're uncomfortable. One of the things that we can do to make a denture more comfortable is we can even take an existing denture and add a few implants underneath for that to click into, and it just gives it more support.
Wow, that's really great. So someone doesn't necessarily have to go in too deep. They can use what they have and still have a comfortable, easy way to handle their dental health. We did talk in our last segment about your patients being calm, comfortable, relaxed when they come into your spa of an office. What's the process to build confidence and to relax your patients when they come specifically for implants?
I think it's the whole team. From our front desk to, the both of us, we try to explain everything. We want our patients knowing exactly what's going on. It's a very soothing environment, and it's a lot of times pain-free what we're doing.
I expect the patient knowing what's happening and understanding what you're doing inside their mouth lends itself a long way towards the comfort level of the folks you're working on.
Absolutely.
So it sounds complicated, the whole process, the whole implant process. How long does it typically take?
So when we're doing this, we do a lot of pre-planning. So we have these 3D x-rays, we have a digital scanner that we map out the inside of your mouth. We're doing a lot of our homework and planning ahead of time, that on the day of the surgery, this all happens in one day. So within about 4 hours, that patient, while they're asleep, we can do the whole entire surgery, place the implants, digitally scan their whole mouth, and we actually fabricate those teeth and design it in-house, that those go in the same day, and you don't have a single day without teeth in your mouth.
So people walk in with a problem and they walk out with a fix.
Yeah.
And 4 hours, that's kind of incredible, isn't it?
Yeah, it's really amazing. I mean, just with the technology, what we can accomplish.
Yeah, wow. So what don't we know about dental implants? What haven't we talked about?
Well, there's a lot of patients that maybe they've been told that they're not candidates, that they don't have bone for an implant. And there's a lot of different techniques that we do that no one else in the area does, that we can really treat these patients and still accomplish this.
So you mentioned the in-house lab. What's an in-house lab? What does the lab do? What do you do with your lab?
So all dentists work with a lab. That's where the teeth are made. In our office, we have an in-house lab, meaning that we manufacture and we design everything for the whole entire process there.
Does that allow you to really control the quality?
Yeah, so everything from the design, so really to make sure that everything's customized, comfortable, but also the quality is all really controllable by us.
So I would expect having an in-house lab also affects your turnaround. That 4 hours that patient is in the chair, is it 4 hours partially because you've got everything you need right there?
Yeah, so with the digital technology, going from the design and actually making the teeth, we can make those in under an hour.
Wow.
For the teeth that go in the same day. But it does, I mean, for different parts of the process and for different types of situations, we have a very quick turnaround to make those for each patient custom made.
So I know we talked about patients being nervous, patients being comfortable. Do dental implants hurt?
So dental implants, they don't hurt. It's something that a tooth has a nerve, an implant does not. So they're very comfortable. It's something that doesn't cause pain, and unlike a natural tooth, you also can't get a cavity with an implant.
Oh, how interesting. All right, so you can't get a cavity with an implant. No nerves to flare up. How do you care for them?
So like any tooth, you still have to brush. Even though we're not worried about cavities, we still want to maintain the gum health around it. So after the implants are done, we still have patients back on a recall schedule, so anywhere from 6 months to a year, where we just inspect everything, we check the health of the gums, and we just kind of, I want to say, help teach on hygiene as well.
Mm-hmm. So do you, what kind of response do you have from your patients who are maybe going from a denture to an implant? How do these compare, and what kind of feedback are you getting from your patients?
There's almost no comparison. Recently, we had a gentleman that went from a denture to permanent teeth, and by week 1 already, he's overjoyed with how comfortable and how natural it feels compared to that denture he came from.
And when you have implants and when you have dentures, I would expect when you eat, it's also going to affect your experience at the dinner table. So what are the differences when someone is eating, and do we have to do things differently or carefully with an implant?
There's so many differences, so many benefits of having implants. Really, they're back to eating apples, corn on the cob, chicken wings, as opposed to a denture, which generally cannot hold up to that. In social settings, you don't have to run to the bathroom and take your denture out, rinse it off. You're just eating like the rest of your family is.
So you don't have to cut your apple. You can actually take an apple and bite into that apple and just like enjoy that sound because you have implants instead of a denture.
Yes.
That's fantastic. And I would think socially, not worrying about your denture slipping, not worrying that your denture is going to have stuff getting in the way, you're going to be more confident.
Yeah, so we have a lot of patients that before they go through treatment, they don't go out to eat with their friends. They're just really self-conscious of what they can eat and do socially. And after they have this, it's just this transformation where their social life comes alive because they can be confident in going out and spending time with others.
So creating a smile can be life-changing.
Absolutely. Yeah, and that's what we see all the time that we love.
That's got to be exciting for you to know that you're a part of that. And we would be remiss if we didn't talk about the future of dental implants. I understand there are some really neat things that are in the works for you in your office.
So one of the things that we've been working on is we actually have been designing, and we're going to be soon manufacturing our own implants here in Buffalo. Just like if you were to go to the hardware store, there's a lot of different screws, and so really how those implants perform and really kind of work in different situations by us making our own, it really allows us to do even more things.
So will you be manufacturing in your lab?
We have actually a separate facility that we're going to be making those in.
Wow. So that is really exciting. So you've got really a few levels of control when it comes to your patients and what's going in their mouth. So you've got, of course, your spa dental office, and you have your dental lab, so you can keep your quality control at the place it needs to be. But now, moving forward, the next step is actually manufacturing. Yeah. So you guys kind of are a 360 office. There's everything coming together, so your patients get the best of what you have to offer.
It gives the patients the best results, but also helps with some of the costs to make this affordable as well.
Ooh, tell me about that, because I'm sure folks are intimidated thinking about what's it going to cost to have my whole mouth done, and it's so important, and we discussed it's life-changing. What are you doing to help people afford this life-changing?
Well, what's nice is we have control because we do everything in-house. We do offer various forms of financing, so we do have a lot of patients that finance it or even have family members do it for them.
So financing directly through the office, directly through you? There's
a lot of different ways. I mean, it's something that we, by being, if you want to say, integrating all phases of care in the office, it really makes things more efficient, more affordable that way. But just like if you were going to go to buy a car, most people don't go in with a suitcase full of money. So there's different ways to make it affordable through financing and lending as well.
So then people don't need to be intimidated by cost. In your office, you understand how important this is for your patients, and you've done everything you can to make it attainable.
Absolutely.
Fantastic. Well, remember, you can call Pure Dental for your appointment at 716-528-6387. When we come back, find out what patients like you are saying about their implant experience.
It isn't a typical dentist office. The people are just very nice. I garden a lot and I read a lot. Retirement is good. I didn't have a problem up until a few years ago when the teeth started getting loose. The last straw was my front tooth popped out. No warning, no nothing. I can smile now without being self-conscious. The place is wonderful. The price is wonderful. 100% I would recommend Pure Dental.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
Welcome back to your Hometown Health Connection, continuing our conversation with Dr. Gregory White and Dr. Elizabeth Michaels from Pure Dental. So, I want patient stories. How do your patients react after that 4 hours, which blows my mind that you can walk in and 4 hours later have this phenomenal smile? Tell us about your patient reactions.
It's my favorite part. We've taken patients who, they come in, they're hiding their smile, they're not looking me in the eye, to somebody who's just beaming, absolutely excited that they have this beautiful smile they can show off.
And I know that there are plenty of offices that do implants, but in your office, you've done how many?
So we've literally done thousands of implants, and with a lot of these, if you want to say the full mouth reconstruction with the implants, we typically do more in 1 month than most practitioners may do in their whole entire career.
Which says a lot about what you're doing, your skill level, and those numbers for a nervous patient. Those numbers are going to help settle and allow someone to be comfortable with what you're doing. So what makes you both so passionate about dentistry? Who wants to go first?
I'll go first, I guess.
Okay.
So in terms of dentistry and surgery, one of the things I love about surgery is just it's complex, and when things are hard, it really makes everything on the back end that much more satisfying with the results and what you can accomplish.
So the challenge and then the satisfaction.
Absolutely.
Doctor?
I always say there's 3 components to what I love about dentistry. There's the science, and I love the science of it. I love the artistry of it, giving people the smile they want, but also people. That's why I'm in dentistry. I love making connections with people and giving them the smile that they've dreamt of.
So are there any maybe anecdotal stories, 1 or 2 you can tell us about some of your patients and post 4-hour surgery when they came out?
So we have this one patient, and we treated him some years back now at this point, but when he came in for treatment, he was very self-conscious. He kind of said that he was in one of like the darkest periods of his life where his social life just kind of disappeared. And after we did a whole entire set of teeth for him, he's confident. He used to play the bass in a band, and he joined a band again. He's performing, and he's just kind of living his best life now.
That's incredible. So without a healthy smile, people shy away from really stepping out and living their life, and then they come to you, and you're able to open the door back up to a wonderful life. That's got to be very rewarding. Any stories, Doc?
Absolutely. So actually one of our coworkers, her mother went through this process, and I've known her for years. She had a denture, never went out to eat, was worried about the denture coming out. Every time we see her, 1, she is wearing the snazziest outfit, and 2, we hear of all the restaurants she's gone to, all the social outings she's been to, and she's always just beaming at us.
I think my favorite part of that story is she's matching her clothes to her teeth. Teeth are an accessory, though. They're so important, mm-hmm. and to feel confident, to feel handsome, to feel beautiful, smile. The smile is just so much. What have we missed? Tell me more. What haven't I asked you that we need to know today?
I think it's that full transformation from the starting, maybe you're embarrassed, you're scared to go out, you hide your smile, to the end of the process when people can't stop smiling, they are confident. Not only that, they're functional. They're eating what they want to. They're, biting into that apple with their grandkids in the apple orchard. They're going to a Bills game and eating their chicken wings. Those are the things that we really love to see.
So we've really learned a lot about dental implants. We've learned a lot about your practice. It's important to keep up dental care. Dental implants really are available to so many people. Financing makes the price not so much of an issue. You've made sure that your audience, your clients, come into a comfortable situation to your dental spa. Forever now, I'm going to call it your dental spa. And you've created just really something incredible, having done thousands and thousands of implants, in-house lab. And am I correct in remembering you also 3D print teeth?
We can 3D print teeth. That's the fastest way to make a set of teeth, but we also will mill, and there's a lot of different technologies too with how the teeth are actually made.
In what situations would you choose to print a 3D tooth?
So a lot of times when patients come in, and we're doing this all at once, the teeth are 3D printed for that set that goes in that same day, but those are really good for a short period of time. They look great, they're functional, but for that long-lasting smile with that strength is typically something that we mill in-house. That's a dental ceramic.
Sure. Well, Dr. Gregory White and Dr. Elizabeth Michaels from Pure Dental, thanks for joining us on your Hometown Health Connection, and stay with us for contact information. If you'd like to make an appointment at Pure Dental, here's a special number to call. It's 716-528-6387. That's 716-528-6387. Pure Dental is located at 6599 Main Street in Williamsville, and you can find out more online at puredental.com. I'm Kim Piazza. Thanks for watching.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.